Yes, let's begin. Well, ladies and gentlemen, boys, girls, and gender rebels, welcome to one of our workshop sessions. Now, here we're hoping to try and facilitate some sort of a discussion. I see there's some speakers listed down the side, but equally, don't forget there's the chat window to the right of the screen where you can post questions, points for discussion, and don't forget, even if you disagree with us, that is something that's very welcome too. I enjoy the cut and thrust and badinage of academic debate as much as anyone. So do feel free to disagree too. Now, what we've got here to perhaps try and provoke some discussion is some examples from our own work and some possible questions which we might discuss. So, Raghu, could you flick us onto the next slide, please? There we go. Here's an example of some people we met, a middle-aged couple from Panani, one of whom is being treated for obsessive compulsive disorder at a mental health clinic run by an NGO. And according to the couple, her illness started 18 years ago when she fell into a well in her courtyard. A life of fear ensued for S, as she couldn't bear to see or hear anything about death or dying. She would bathe more than 10 times a day and forcefully bathe her young children too. Her husband wasn't supportive at the start and would beat her for her strange ways. S laments the fact that her life was hard with no support from her husband and his family. K, the husband, repents his past actions and attributes it to a lack of awareness and not a lack of love. He speaks of his initial encounters with the faith healers, Thangals, Ustads, and Mantravadis, and felt they were fleeced by the healers. That's an important point. We were talking about spiritual aspects of care and traditional medicine earlier, but very often these people charge for their services, and with a long-term problem, a great deal of money can be spent. Fleeced by the healers with tall claims of curing his wife, but instead left them with huge debts. S feels that despite her helplessness, her faith and prayers brought her mental peace. Quoting the Islamic scripture, Surat al-Nas, she added, if we have this disease and if we're badly in need of help, we can chant and pray and God will heal it for you. The couple feel that it is only treatment at the clinic and a strong belief in God that can help one recover from mental illness. Yes, she's happy now and recovering and loves to cook for her grandchildren and neighbours. So if we flick onto the next slide, there's some questions and suggestions, possible things to discuss, such as, well, what does the problem seem to be? How does it seem to be affecting family relationships? Take how it's and what other resources might there be that would help people? Fire away. If you're able to unmute a microphone, do jump in, or alternatively, you can post a question or observation in the chat about this.
Any contributions from you in terms of what's the problem here? Do you want to come back to the case study again?
Yes.
Okay.
So, any observations and comments?
So, I think what is actually affecting the family relationships here? Does anybody have a clue about what is actually affecting the family relationships here? Because I think the most important point in terms of well-being and being together is crucial here.
It's lack of information. They
Hmm.
are
Mhm.
in terms of about OCD. There may be information that there is a mental illness, and maybe the medicine is helpful, but there is no intense information on what is OCD. So the family is relying only on medication and a reliance on God and prayer. But other than that, what maybe the other forms of psychosocial support is missing. That's one problem.
Yes, yes,
Psychoeducation to the family and the children, and maybe support to the spouse, etc., is also important.
yeah,
So, caregiver burden as an issue,
yes,
psychosocial support, psychoeducation to the family. These are some aspects that are missing, and those are the problems I would see here.
yes,
Yes, I think that's an important one because although informal carers play a very important role in looking after people who are distressed or disorientated, and also with many other health problems too, these relationships are not always easy ones. And as you can see in the example that we just gave, it describes how in the early stages they actually came to blows. So finding a way of supporting carers, enabling carers to understand what's going on in a more humane way, trying to help prevent or manage conflict in caring relationships, I think is quite an important thing here that's come out of this. And I was also struck by what it must mean for the children, to find themselves suddenly being bathed several times a day, rather than once a day or once a week or whatever. Um, Having to try and make sense of what might come across as rather strange or unusual behaviour on the part of a parent, and what implications that might have for their future relationships.
yeah,
I don't know the answers to these, but it struck me that there's a whole system here where kind of people's lives, livelihoods, well-being are affected.
yeah.
Yeah.
Shall we move on to the next one, Brown?
Well, let's have a look at another one. Yes, let's.
Yeah. So this is a case study from Attapadi, where there's a 29-year-old male from Attapadi, the tribal community, enjoyed studying and joined a polytechnic course in the town, but was actually forced to drop it out because of the ragging and other by the seniors. Was actually pushed him into a downward spiral and started drinking, and he felt the pressure to be like the peers, that everyone drank alcohol and took drugs. And when he realized that he couldn't control his alcohol, he actually tried to mend his ways. At the age of 21, he eloped, but his parents weren't happy and was ostracized from the family. A year after the marriage, he started to hear voices, swear words, and felt others could hear thoughts. He quarreled with his friends and beat them, and even tried to stab his neighbor. He was taken to the temples in Tamil Nadu, where they performed religious rituals like shaving his head and trying the sacred thread. He also tried black magic, and has given herbal medicine, which he had to apply all over the body. All of this only worsened his condition. He also lost a lot of money in going through this process. And fights started erupting at home as he was suspicious about his wife. He drank too much and was admitted to hospital, following which he attempted suicide, and his family chided him and even asked him to go and die. He feels lonely. His friends tease and make fun of him, and no longer has the respect. And things have become better after he started the medication. He's determined that one day he will go to work and take care of his kids. He believes in the grace of God and also feels that it is the Lord Almighty who has given him this illness. He prays and visits religious institutions and finds comfort in spending time at the church. So it's a very dramatic story. And so our kind of points for discussion here, what does this young man's problem seem to be?
Should I only start?
Yes, please do. We welcome your thoughts.
Please do.
I would also feel happy if Anaga and Ramshida Malu joins in, but I will start. Maybe that. For me, it's plethora of issues in these few lines. When I'm looking at the young man's problem, I would not even jump into his illness and addiction, but I would go to the first two lines where I'm seeing he's from Attapadi and he's joined a college and there was bullying and ragging. So I would also go back into, his social location as a tribal youth, moving into a urban space, cultural alienation. Even at that level, he was not supported because when we are looking at cultural diversity in university spaces, we keep talking about support mechanisms. So even if I'm looking at causation, how a tribal youth, cultural alienation and social causation, I would put that. But again, because I'm not looking at a full narrative with the two lines, I'm thinking as one, his social location, that's his problem. And when a young adult with so much vulnerabilities, he's taken to alcoholism. And from there, so I would feel that he never was supported. That's one. The second is the entire narrative. It looks like he was taken to. I'm also looking at where was his sense of agency as an individual in all of it. So these are two I would see, his sense of agency not evolved, the socializing patterns in a tribal community, moving to a different space, cultural alienation, lack of support mechanisms. These were the problems around the young man.
Yes, that's true. What do others think? No right or wrong answers here. So.
Yes, any other comments or observations from anyone? I suppose one thing that struck me was the way that following the bullying he experienced at college and going away to college or university is often a very stressful experience for young adults. It's often one that they welcome, but it's often one they find very stressful. His initial coping strategy to turn to drink obviously went wrong very quickly and rapidly became problematic. A little later on, he's found spiritual comfort and spending time at church, kind of prayer and so on, seems to be offering him some succor, some consolation.
Yeah. And I think here also there's a call for a whole family approach here in terms of looking at his wife and the children as well. And I think they should not be just looking at just him as a factor, but I think the totality and how the kind of relationships and how that relationship could be built and the kind of issues that's being currently faced as well. And also there is a role for education literacy here, mental literacy here in terms of understanding the concepts, what he's actually going through. Because I think often the family support is not actually there because the family doesn't know what the other person is, a wife or husband. They don't know what is actually happening in that kind of
It's
context.
also like marriage is secure, go and die, discriminatory statements.
That's right. Yeah. And also the totally, something people often say that, oh yeah, it doesn't actually happen in my family. And I think that goes on. So, again,
well, I'm coming at this myself as somebody who, outside of my academic life, I've also been an informal carer at various points. And even in a country like the UK, with comparatively well-funded and well-developed services for virtually every health problem you can think of. It is enormously exhausting and frustrating. That when people are in distress, they often, by comparison, seem to have a great deal of energy. There's often conflict in caring relationships, as we've highlighted. So, in some ways, it's not surprising that people around an individual in distress, they will get out of temper sometimes. They will say harsh and incautious things, because it's enormously hard work. It's very difficult to be an informal carer and keep one's temper all the time. There's probably very few people in the world who could do that. However, it highlights the importance of there being support available for the whole family, for the whole nexus of, maybe a spouse, maybe a parent, maybe children caring for adult children caring for parents who are distressed or disorientated, and perhaps enabling people to understand and understand what it does to them as a carer.
Yes. Yeah. Shall we move on to the next one?
Yes.
So this is a case study from a community member in an urban area with a journalist working in a well-known newspaper and enjoys the written word. And she feels it is her first thirst for knowledge that helps her to cope with life situations. And according to her, the family community perception is influenced by the portrayal of mental health in the media and movies. And she added that there is a common notion that artists are mentally unsound. That's a very popular notion, actually. And that some artists are even consider it a badge of honor to be in that kind of unstable realm. Although there is stigma, Kerala is actually changing, and the movies like Kubalangi Nights have sparked conversations around mental illness. She feels people are more aware and can recognize signs of depression, and societal constructs and pressure often push people to the brink and can lead to mental health issues. School pressure and almost broke her spirit. She added that if a friend of hers is not mentally well, she will ask them to go to a psychologist or a psychiatrist. So there is that a clear notion of the services around here, and let's go to. So what do people think? As a personal journalist, what role might people in this position play in fostering a more humane attitude towards people with mental health issues?
A responsible communication, appropriate communication, journalists have a major role to play.
Yes.
So while they are writing, and in this there are notions like artists. So again, there is a stereotype there. So responsible, appropriate communication is very important. And
Yes.
definitely journalism has a role because people still read newspapers, people read magazines, and more than published articles, the community consumes more of magazines, newspapers, etc. So journalism has to be responsibly done. So
Yeah. And I think quite rightly in the story, like I remember going back to my younger days in Kerala, and I think many people actually said film directors have to drink alcohol. And I think it is only then the art actually came through you. And I remember, seeing Padmanajan and MT Vasudevan when they were actually in the shots, and and then you kind of respect that alcohol intake that people actually have. It is actually the most popular thing when you're actually young person, and think that it is a must for art to come out. And I think some of the clear poets during that time also sort of promoted that notion. Without alcohol, you couldn't sing a poem. I think it might be a personal issue, but I think whether it is actually kind of, whether that pushing that to the public domain and public knowledge and practices is a different thing, isn't it?
Yes, and people have similar beliefs sometimes about other recreational drugs too, that somehow they're involved in enhancing creativity and opening people up to other experiences. Very often when people do try and produce a piece of music or paint a picture or compose a poem or something, when they're under the influence, actually it's crap. They do much better if they were sober.
I think what
Sorry.
I think what Raghu sir is still persisting in Kerala because with the emergence of the social media and people started explaining their problems and opening up about mental health issues with celebrities coming up with their stories of recovery and medical health care regarding mental health. There is also a trend in Kerala that we have to be using or consuming, we need to be creative or a creative man or a creative woman must be using drugs or something of that sort. And this is a dangerous thought. This is seen as drinking or consuming alcohol is seen to be as a symbol of progressive people. And they are drawn to this, especially in university campuses when students at the age of 18 or 21, they'll be attracted by these ideas around. They'll be taught by the research scholars or somebody there that you have to drink. This is liberation. You have to go and do this. Do this. Anarchy is life. That's what you have to do. And people get attracted. Young students get attracted, and there is a trend. If somebody asks me, you want to drink? If I say no, they said, oh, you are not that liberal. That's a case.
Yes, I think that's an important point. We seem to be getting an awful lot of background interference and feedback. Is somebody's microphone misbehaving? Okay, say something again. It's still troubling us. Let's try it again. Is it still happening? Yes, it's still happening, unfortunately. Could we try muting our microphones for a moment, please? Is it still happening? Yes, it is. Okay. Well, I'll mute mine and
Sorry, I think she has gone. Anyway, I think there's a message from in the chat box. There is a chat from Sindhu as well that the cultural alienation. I think that's actually the first case study. Am I right? I think if so, that is the case. I mean, cultural alienation was beginning to trigger all the problems in the first instance, perhaps. Is something?
Yes, and I think that's something that's perhaps a very important point, where people move from one community to another, perhaps to look for work or to attend higher education, and enabling people to feel capable of doing that, enabling people to feel that they are not out of place in the new environment, I think is very important in sustaining well-being.
Yeah.
In the UK, there have been many similar debates about people going to university, if they're going to university from families where people don't usually do that kind of thing. They move away from home and their community, and they go and visit a place where go to college in a place where they feel like a fish out of water. This can sometimes have quite profound effects on young adults. They never quite feel they fit in, and
okay.
Yeah, and as Cynthia's just added in the comments, yes, I mean, this might encourage people to adopt maladaptive coping strategies, like in this example, drinking, which rapidly became problematic. And as Anaka was saying a few moments ago, the way that things like drinking and drug taking have this sort of, kind of rather glamorous image. Yes, I've always had that sort of problem because very early in life, I discovered that alcohol didn't agree with me, so I stopped drinking. It's expensive and it makes me feel terrible, so I'm not going to do it anymore. And obviously, this elicited some hostility and so on from my contemporaries at the time. Now I'm older, actually, more people have come around to my way of thinking. People who've had unhappy experiences with alcohol when they're younger and don't do it anymore. So it's perfectly possible to be teetotal in a drinking society. And after a while, people will start agreeing with you. Well, that's been my experience. But certainly the pressure to drink is often very strong when you're a young adult.
Yes. Also, comment saying the inclusive and affirmative practices in educational space is important, and that people have this feeling about drugs that it takes them to different dimension. Yeah, that's true, and I think that is the kind of false opinion of and I think it's people actually taking that. I've seen, young people, and even in my younger days, and I think I've seen my, peers taking a particular drug so that it actually helped them to actually write the examination well. And I didn't take them gladly because I don't know why. I was quite frightened of that. So anyway, I think there are all these kind of things going on in young people's, and also it doesn't necessarily have to be a young person, but I think in older people's circles as well. And I think older people also take some of those recreational drugs to increase their social mobility, social interaction, and many other things as well. So I think it does actually, more harm in the long run. So there are those kind of issues that people might actually feel.
Yes. I didn't really used to do this. I was never one of the cool kids who got invited to the sort of parties where recreational drugs were available. I was always very nerdy and swotty as a young person. But where people were attempting to use things like, stimulants, amphetamines and so on to enhance their performance in exams, what they ended up writing wasn't necessarily any better. They could write a lot, but they usually wrote gibberish, which didn't necessarily do them any better in the assessment than those of us who'd done it the old-fashioned way. So it doesn't necessarily get you anywhere. Oh, and Anaka said something about drinking and drug addiction and feminism. Well, yeah, sometimes you get people who say, well, equality. Well, as a woman, I can drink as much as a man. But then equally, there are important strands in feminism which emphasize women having control over their destiny and having autonomy and becoming more empowered, where perhaps you don't need to drink at all or as much. There are strands in feminism which emphasize the importance of self-improvement and progression and taking advantage of educational opportunities and empowerment. And again, these can be quite focused upon, these can be very Protestant work ethic, if you will. They can be very focused upon being more abstemious too. Mm-hmm.
Yeah, I think shaping that into the policy angle, I think it is actually very the contextual stuff in Kerala because of the alcohol, mainly alcohol, is a major source of revenue for the government in terms of taxes. So there is very little in terms of how the government is actually taking action on it. Not just in Kerala. Kerala is one of those states, I think. But I think it's about what is responsible drinking and other things need to be part of the action plan, and then how that should be included in the mental health literacy, public mental health programs is something that need to be considered. So it is a common sight in Kerala where people only queue up for alcohol and they don't queue up for anything else. Um, it is a social issue, majority a social issue, and I think many families, especially in the lower income status, are actually affected. Also in the higher income status as well, in terms of overuse of alcohol, leading to a lot of physical health issues, mental health issues, marital issues, etc. So I think it is worthy of discussion in the public domain for in terms of the policy. Yeah. Uh,
To add to what Brown has said, there is another dimension for this linking feminism with drug abuse and alcoholism. Because what I meant was that people here just blame feminism for every. This is big, women have started consuming alcohol. They are drinking. They are drinking like men. This is all because of these feminists. And feminists are called feminicis in Malayalam as an abusive word. As we hear with every abusive word, we use the term itchy. Like that, we have developed a new term, feminici, to describe who is a feminist and who a woman who drinks, who smokes, or who uses any of the drug is seen as a feminist. That is widely seen as a symbol of feminism. The people just don't have any idea of feminism, and that's what they associate drinking and all these activities with feminism. If they see somebody consuming all this, oh, he is a feminist or she is a feminist. Mostly they associate this with women, sadly.
Yeah. Having said that, I know there's always in popular media and popular discourse, there are always ways in which people try to belittle and undermine women and what they do. However, on visiting India and meeting colleagues and other folks in India, I'm very impressed at the progress that girls are making within the education system in India. That young women are doing within the university system and finding their way into the professions. And there's splendid colleagues like Asha here and Sivakami. If you're choosing a country in which to be born as a woman, if we could choose before we were born, you could do worse than choose India at the moment, because over the last couple of generations, opportunities for young women to gain education, gain professional status. And you've only got to look at the ambition that many young women have. That's come on by leaps and bounds. So I wouldn't worry about a little bit of minor teasing around the edges. Look at what you can do.
Okay, we have a minute. I think it's 6:50. Is it 6:15? The break.
I've added in the comments that policies promoting community-based models and social innovations is one. And also policies, the existing policies like district mental health, we have this mental health program. Targeted interventions are part of mental health program, school, university spaces. But I think funding is the problem there, or how do we emphasize on these aspects? And also, like for example, the tribal boy, where we are talking about cultural alienation, bullying, ragging, university mental health, or systems promoting integrating people from diverse groups into the campus is one of the targeted interventions. Should we look at spaces like that? Also, like targeted interventions like workplace mental health is also one. I do not know about the first one, but then whether the women was working or not, but then that kind of concessions also is very important. Because I think when we are looking at policy, funding is a major crunch in India, like 0.5% going to mental health interventions. While we say that only 0.5 is going for mental health interventions, 0.5% of the total GDP goes for mental health interventions. Within that 0.5 also, major chunk goes in maintaining and running institutional models. So that should be one way to increase, acknowledge, recognize community-based models, somewhere that also can be as part of our study, like our field partners, MEHEC and MHAT, how they have proved certain arenas and what is coming out of the narratives also is very important, that community-based models can go a long way.
Sure, yeah.
Mm.
These are some thoughts in the head.
Yes, yes. I think, as you say, one of the problems is that with mental health care, it's often not been seen as a particularly glamorous or urgent problem for many policymakers. When you look at the resources that are expended upon things like, oh, I don't know, cardiac care and heart transplants, or kind of cures for cancer and so on. Things that politicians can have their pictures taken, shaking hands with people in front of new hospitals, that kind of thing. Mental health care has often been a bit of a poor relation and has struggled. So maybe part of the argument, as we've tried to hint in these points here, is trying to persuade policymakers that this is something that they should be tackling and something that they should be allocating resources to.
Yes, I think that is very true, Brown. I think in terms of throughout the world, I think that is the case, and I think it is not actually seen from a glamorous context. And I think, and also because, especially in many other countries, we've just, because mental health policy is actually just saying that we should increase the number of hospitals, we should increase the number of psychiatrists or psychologists. But mental health is not just a physical context; it's a social, environmental, employer, as I mentioned, the employer context as well, and all those things. And how do we bring them all together? Unless and until people actually have a collective discussion around it, and I think it's very important. And also, what is actually lacking? What are the kind of good practices that are going on? And I think we need to tap on the good practices that I'm sure there are a lot of good practices that goes on in India, which I think is untapped in terms of knowledge base. From various companies actually do that, various organizations actually do that in terms of how promote those things as well. So, and some of the primary healthcare workers and the physicians might be doing important pieces of work. And I think those are all untapped resources that I think we should actually be made aware, and I think make it more glamorous in terms of how other professionals might actually work. People with diabetes, people with heart disease, and all those things, they also have mental health issues and the mental health care needs in relation to many of those things. And I think it's not just the extreme cases that should be addressed, really. So I think it's a kind of collective action, collective discussion. And also, in terms of how is it a kind of a wider social policy? People should actually have the time for leisure with the family. Everybody works from 9 o'clock till about 10 o'clock at night in many companies in India. Do they have time to sleep? Do they have time to spend with their family? Do they have time to be with their children? And all those things are very important, really. So I think on that notion, I think it's just there's a 10-minute break. I could do with a 10-minute break. So, so obviously, but it's a contentious issue. I'm sure we will carry on with this conversation on a different medium after this. Yeah. So thank you very much for all of you.
Thank you so much.
You, for leading the discussions, and thank you, Sindhu, and thank you, Anaga, and thank you, Dr. Ramshida, for all your comments. And I think it's been extremely useful, and I think it is actually shaping, because there is no one unitary policy here that governs everything. And I think bringing in all the kind of different dimensions to this equation is what is important. Many thanks to all of you.
Thank you.
Thank you.